Conditioning is the simultaneous presentation of auditory stimulation and rewarding in order to elicit a reproducible reaction to sound. We must be sure that all presented sounds can be perceived by the child. The starting intensity, therefore, must be way above the estimated thresholds.
Ja, zo. Oh, maar ja, dat kan ik gewoon. Kijk. Kijk, nog een beetje. Goed zo. Goed zo. Bravo. Ja.
If the child is suffering from otitis media, a starting intensity of about 70 dBHL will do. If we have reasons to expect the hearing loss to be severe, it's recommended to start with high-level, low-frequent stimuli. If the child is not hearing, it is certainly feeling vibration and isn't rewarded without reason.
Oh, ja. Ze kijkt naar de Ernie. Kijk. Oh, de visjes. De visjes. Bravo. Flinke meid.
It is not the chronological age that is used to choose the test protocol. It's the developmental age, which may depend on the cognitive level of the child. Persistent observation of the child's reaction and quick decision-making on the test protocol that has to be chosen and necessary to have a successful testing. You will see Axel, who's a deaf developmentally impaired boy. Sometimes he's showing reliable reactions when doing play-conditioned audiometry, but today his auditory attention is very limited. The distractor, Karina, is conditioning him to react when hearing the sound eh in a series of background sounds e. After the first presentation of the sound eh, he articulates the eh without voice. After the second presentation, he shows the same response with voice. Karina takes advantage of this behaviour and encourages him to repeat the sound eh each time he hears it. After the third presentation, he shows the same reaction, but only a few seconds after the stimulus sound presentation.
En erop. Nog zo paar, Christine. Nog zo nou. Goed zo, man. Nog, hè. Moeten er veel in, hè. Veel luisteren. Zoveel, ja. Heel veel. I. 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 Ja, goed zo. Ja. Hij is in een andere wereld, hè. Hij zegt nog, hè. Jij moet het vertellen, hè. Jij moet vertellen als je hoort. En dan boem erop. Maar jij moet het mee vertellen, hè. I. Dat is nog niet de hè. I. Wat gaat komen? Hij is gewoon trager vandaag. Hij komt met latensiteit. Ja.
During the conditioning procedure of the young ones, several ways of rewarding are used to elicit and maintain the reaction of the child. Socially, by saying bravo, well done, etc., or by doing a thumbs up, clapping hands, by using enthusiastic facial expressions that are more exaggerated than normal. Also, visual rewarding is implemented using visual reinforcement systems.
Dat was al duidelijk, hè, vriend? Ja, goed zo. Hey, goed zo. Jorre.
At the age of 6 months, the head turn is not always developed or present yet. Therefore, it can be a good idea to put the rewarding system at 45 degrees and not, as usual, at 90 degrees. The testers are conditioning the child, but conditioning also works the other way around. Observing the child, the testers try to find out what the typical reaction of the child is to sound and adjust their behaviour to the child's reactions. For example, when children look up to the distractor or to the parent as a reaction to the sound, the distractor's task is to direct the child's gaze downwards. The child is then stimulated to show a head turn by leading his attention to the rewarding system. We prefer a head turn when perceiving sound, but in fact every reproducible reaction to sound is okay. In most children, orientation audiometry can be done from 8 to 20 months of developmental age.
Dus kijk naar mij, hè. Dus kijkt weer naar mij, hè. Kijk. Kijk. Ja. Ja. Heel flink, bravo. Goed zo.
When we assume children are ready to do play-conditioned audiometry, we stimulate them in several ways to take that step. In most children, performance testing can be done from the developmental age of 30 months onwards. Mauro is 2 years 8 months of age and is thought to be able to show he's hearing something by playing. It's important not to reinforce his orientation reflex or not to use the visual reinforcement systems, but to reinforce the desired response behaviour. We like children to hold something to their cheek to stimulate their listening attitude. Sometimes it's really necessary to drill a child to obtain the desired response behaviour. Imitation still is very important, but verbal instructions are as important from that moment on.
Ja, goed jongen. Zo, en weer luisteren, hè. Ja, bravo. Rijden maar, Mauro. Mauro, jij mag rijden. Zo, hier. Ah, brrr, hopla. Ja, bravo, Mauro. Boem, zegt de auto. Huh? En nu weer boem. En nu weer luisteren. Ja, ja, heel flink. En een beetje wachten. Goed zo, rijden maar. Heel flink hoor, vriend. Als je hoort, boem, bal erin. Klop maar. Hier, zo. Jee, goed Emily. En nog hè. Zo, eerst luisteren. Ja, goed zo. Ja, bravo.
The distractor also adjusts the intensity of distracting. It's known that very young ones are quickly impressed about what's happening in front of them. The attention of the child is always divided between the distraction and the auditory stimuli. In case the child's attention is really focused on what's happening in front of him or her, a response to the sound won't appear. Then the distraction must become less intensive or less interesting and less attention-catching. This is what the distractor Christine is doing when distracting the young Henry. After the first stimulus presentation, he doesn't react at all. Because he is probably too impressed or interested in the movement of the toys, Christine decides to stop moving. Stopping the movement of the toys while distracting when the stimulus is presented is not a good idea. In that case, the distractor gives a visual cue. Here, the discontinuation was done before the stimulus presentation, and this is very important. As a reaction to the second stimulus, Henry looks up. He is rewarded socially, verbally and visually.
Ja, ik leid hem gewoon af naar beneden, maar niet te veel, hè, want het is een enorme kijker. Ja, oh, je verschiet van mij. Kijk, 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 jongen. Wie heeft dit gezien? Ja, flink zo.
When administering the ACE discrimination test, we teach the child not to react when perceiving sound, but when perceiving the odd sound in a series of background sounds. This method is called the oddball paradigm. Depending on the age of the child, we are looking for a head turn or a play action as agreed upon. You see Eloise reacting on the sound E in a series of OO sounds, first during the conditioning procedure and then when testing.
Quand on entend le I, on tape. Ouais. Tu peux choisir. On attend le I. Oui, bravo Héloïse. Encore le I. Oui, bravo, très bien. Et encore le I.
Vert.
Vert, oui. Bravo, très bien. Encore une fois, oui.
Lengthening the stimulus sound is used to facilitate the conditioning procedure. Here you see Amina during the conditioning procedure of the discrimination of and z.
Dat was voor de zzz. Ja. Paardje is stil. Paardje is stil. Paardje gaat slapen. Kijk.
When the ACE discrimination test starts, the child will show head turns as a response to the background sounds which are repeated again and again. This is a very normal reaction. This behaviour must be discouraged in the same way false positive reactions are discouraged. The distractor explains that the sound is not important and distracts the attention to the front. That's the sound oo, but we don't listen to the oo, we wait for another one. When the conditioning stimulus sound is launched, most of the children's faces will register surprise. The distractor confirms by repeating the stimulus sound and by fixing the attention to the visual reinforcement system.
Dat was de A.
Oh yes, that's the A. When we hear A, the fish will swim. Again, social reinforcement is important.
Ja. Dat was de A. Kijk eens hier. Dat is de O, daar kijken we niet naar. Hè? A. Hebben wij de A gehoord? A. En dan gaan we kijken. Ja. Bij de A gaan we kijken.
A possible way to stimulate the child to listen carefully is using movements. As long as the background sounds are presented, a kind of no movement can be used. Don't react, you're hearing background sounds.
Qui ça?
Papa.
The stimulus sound can also be accompanied by a movement. For instance, by a movement that shows the character of the sound. In fact, anything that can be used to fix the attention of the child is great.
C'est l'abeille. Vous connaissez ça?
L'abeille.
Et ça, c'est Christine. Ah, écoute, ça, c'est le zzz. Et tu mets. Quand on entend le zzz, tu mets. Ça, c'est le Elle n'a pas, je pense.
Cornelia is a hearing-impaired child of 2 years, 2 months. In the beginning of the test, we reinforce her to show a head turn when hearing an odd sound in a series of equal background sounds. Again, all possible cues are used to explain what we expect her to do. The distractor lengthens the stimulus sound. Here, the sound s uses fingerspelling and mimics. She invites Cornelia to move in the same way she does, saying no when she hears the background sound. To make it easier for the child to pay attention, the sounds are presented louder than default. Only the scores obtained on the presentation level of 70 dBHL are used, but to awaken a child, louder presentation is often useful. Because Cornelia is too busy playing with the puppets, the distractor takes the puppets away and waves goodbye to them.
Ja hoor, Cornelia is al naar de visjes aan het kijken. Oh, Cornelia, luister eens.
Ze is niet gevallen, meisje.
Hier is het, kijk. Luister maar. Oh, oh, oh. Cornelia, heb je dat gehoord? Zo. Ja, en dan zwemmen de visjes. En nu moeten we een beetje wachten. Oh. Misschien een klein beetje volume bijgeven om zo even haar aandacht te trekken. Oh, Cornelia, nu moeten we weer wachten, hè. Kijk, doosje toe. Oh, dag. Dag. Zo, en nu gaan we luisteren naar Cornelia zo. Ja, joepie, de visjes. Heel goed. En nog een keer.
The transition of the conditioning to the test procedure is often hard. Cornelia's attention is guided towards the stimulus sound by repeating it again and again. The condition procedure can be continued in the test mode to give the child the optimal chance to learn to react properly. To have good eye contact with Cornelia, the distractor, Christine, sits on the floor. She tickles her hand to draw her attention again to the front.
Ja, heb je het gehoord, Cornelia? Ja, dat was de... Ja. Zo, kijk. En de visjes. Bravo. Zo. Bravo, Cornelia. Nu een beetje wachten. Ja. Cornelia? Nu niet, hè. Nu is het de z. Doe maar mee met de vingertjes. Flink. Heb je het gehoord? En de visjes? Ja, de visjes voor de...
To draw her attention to sound and to make the situation more challenging for her, we try to change the head turns to play actions as responses. Response behaviour, such as head turns, eye and mouth movements, are reinforced and Cornelia is stimulated to play the game when showing that behaviour. After a while, she is doing the performance test spontaneously. Christine's reaction to Cornelia's false positive response is gentle. She's only inviting her to wait a little longer. During the conditioning procedure, the distractor tries to adjust indecisive behaviour to obtain clear reactions. As a consequence, false positive reactions aren't really reprimanded.
Bravo, Cornelia. Nog een keertje. Bij de A. Wacht. Nu. A. En erop. Heel goed. Nog een keertje. Wachten. Ja! Oep. Goed zo. Heel flink. Heel flink. Nog hè. Wacht, steek je beentje eronder mee. Ja. Wacht hè, op de A. A. En erop. Nog hè. Als je A hoort, erop hè. Wachten hè. Ja, goed zo. Ik zag dat naar je oogjes. Goed zo. Maar flink hè.
Shy children, such as Matthias, need to be encouraged to talk loudly and clearly. Holding the microphone in front of the children helps. Explain to them that somebody outside the sound-treated room must be able to hear what they say. To listen to words through the loudspeaker for most of the young children is quite unfamiliar. Live presentation of the words helps to teach them what they have to do.
Nu gaan wij luisteren. Zo. En met ons vingertje tonen. Dat is voor strakjes. Zo. Olifant. Waar? Ik kijk ernaar. Waar? Mauro mag kloppen, kijk, zo. Doe nog een keer, Katrien. Mauro mag kloppen. Olifant. Ja, klop maar. Olifant. Boem. Ja. En nu weer luisteren. Ja, genoeg. Genoeg. En luisteren. Ja.
Vis.
Waar? Waar? Toon het maar. Waar? Waar is de vis? Ja, heel goed. Prima. Weer luisteren. Wacht, Katrien, ik ga op de hamer doen. Zo. Zo, en weer luisteren. Zo. Mauro ook. Ja.
Bal.
Waar? Waar? Wat heb jij gehoord, Mauro? Mauro, waar is de bal? Ah, daar, ja. Goed luisteren. Shh. Niet te hard, hè. Want de tafel gaat kapot zijn, hè. Dat mag niet. Beetje zachtjes. Zo.
In case of closed set tests, we must be sure that children know the words used as test stimuli.
Wat was dat?
Een vis, dat is dus een vis.
Ja, en dit?
Dat is een groen.
En dit?
En dat is dat de watertoestellen.
Dat is water. En dit?
Wat is dat voor radic? Kijk, dat is de water.
Dat is het water.